It's a pleasure for me to be able to share with you as the CLLAN Steering Committee Chair some initial insights and observations leading to recommendations from the global CLLAN survey of organisations supporting patients living with CLL. I think a good thing to start with would be what's been affecting us most, that's been affecting our patients most, and is likely to going into the future. And as organisations supporting our patients, we have been massively impacted and responded very, very well and very quickly to be able to meet service needs. This talk isn't going to cover a great number of the unmet needs and recommendations. Time doesn't allow, and to prevent a whistle-top tour through, I think we're just focusing on a few key elements. So if we start with COVID, and if we look at how COVID's impacted on access to support services, working from the returns of those that participated in the survey. If we looked at support services that were reduced and stopped, just over half, that's 53% of organisations that had to stop or reduce any of the support services they provide to CLL patients because of the COVID pandemic. And we know there are several reasons for this, and we've been discussing that during Horizons, so I won't go into the detail of the whys, whats, and whens. If we look at support services that were adapted, I think this is where we performed really well as a network of organisations. Nearly 3/4, 72% of organisations reported having to adapt some of their support. And now this is an ongoing situation. It's not just one moment in time. At the time of the survey, this was taken. I think we can pretty much assume that this is the case still today. What is interesting is that engagement with patients during the pandemic in the past, maybe less now. Obviously, we'll have to get feedback from all of you on that. But over a third of organisations reported that CLL patients who were already engaged with them made more contact during the COVID pandemic. And just under a third of organisations said that more CLL patients contacted them for the first time. Now, we don't know at this moment whether this is due to the fact that we'd had to digitise services and we were more reachable and we're reaching more. Or is it because healthcare professionals and other means of information and support were not open to patients and that patients were more in distress, so they were reaching out to us? But it's an interesting observation. So we've been doing a lot more with less. If we look at funding and fundraising, we know that organisations are already challenged with funding, and many are underfunded and rely very heavily on volunteers. And if we look at organisations that were asked of the overall impact of the pandemic on the ability to secure funding, 2/3 were impacted negatively. And only a very small number of organisations, 3, managed to experience a positive impact on funding. So we're looking forward to learning the lessons from our network members who have managed to achieve this. The second slide looks at perspectives from respondents as to patient experiences with regards to access to their healthcare and treatment during the pandemic. And if we looked at treatment, probably this is during the peak of the pandemic, nearly 45% of organisations said that their patients had reported that there was a treatment delay. And over a third, 38%, said that their CLL patients have reported changes to treatment. Now, I think during the conference, our clinicians will have been able to explain much of this and what the situation is going forward. But it'd be interesting that we've managed to learn what the policy is moving forward, as the pandemic is still impacting massively on patients. In-person activities are curtailed, and much of the activities, as it says here, just under 2/3, 61% of organisations said that their CLL patients' appointments have been postponed or cancelled. 2/3 said that their CLL patients reported cancelling their in-person appointments, which means remote appointments have been taken up more broadly now in terms of healthcare provision. And just under 2/3, which is a considerable amount, 64% of organisations, the patients are reporting now that appointments are being made and consultations are by telephone or video conferencing. And with the pandemic still causing this impact on how service delivered. This looks like this is something that's going to be moving on into the future. So we need as a network to look at how we address this to ensure that network members and organisations are providing the right support to the patients that are under their care. Clinical trials, that's an interesting one. Because of redeployment of staff, clinical staff, and because of the overload in hospitals, many of the clinical trial services had to be stopped. Recruitment had stopped, and of those that said clinical trials had been stopped, 91% said that now recruitment had started. And I think if we're looking at that, those are in countries where the pandemic isn't peaking in terms of hospital admissions and impact on the staff. But I think one that's really interesting, and let me put this here in a bold highlight, over 3/5, 63% of all respondents, so out of 57 who responded or felt they could respond, 63% didn't know the status of clinical trials. Now, we need to just explore this further. Was this a moment in time, or is this actually an observation of awareness within the network of organisations that responded to the trial of status of clinical trials in their countries and what's available to their patients? This slide looks at how many organisations had adapted their services during the pandemic, and I think the red says it all. And there are some striking ones in red. There is variation by region. It seems that in North America, everybody there clearly had to make, there are 6 respondents had to adapt. So if we look at this, nearly 3/4, 72% of all organisations reported having to adapt some support. And I think we know from our own practical experience, having had to digitise many services, that's the only way that we could deliver them. And that's the only way we could maintain the support and contact with patients and educate and also help with navigating many of the uncertainties that's been the case. But it's interesting where such a significant number haven't. Now, whether that's down to resources on the ground, infrastructure to be able to maintain digital connection, or level of infection, societal change, or if they already had a lot of digital connection, digital service delivery in place, we need to explore this a bit further. But I think overall, what we need to do is perhaps give us all a pat on the back, and that's everybody. It's incredible the amount of speed and the speed with which everybody switched over to service delivery to maintain their support for their patients. So I think well done, everybody. And this is now an ongoing situation. We all know that we had to do a lot more with less, and it was a constant crisis with misinformation, lots of uncertainties, constant contact to advise patients on how to keep safe and how to get the support they need in an environment where they're totally isolated. So if we actually look at support service provision during the pandemic, looking at the chart on the right, I think that clearly shows that that's very top heavy around information. So the information demands have been massive, and it's been a moving target with massive uncertainty. But it's also reassuring to see how many organisations have also managed to adapt or change their service delivery model to be able to incorporate conventional support and support activities by extending resources, looking at new helpline facilities to cater for this, and increasing capacity in existing services. So again, I think that's a well done to everybody, and we're looking forward to learning from the experiences of you all. Now, this slide addresses an interesting question. What materials do you not provide but would like to? And coloured in blue, you can see those that are digital related. So again, this kind of adds to the digital move at the moment and the need of patients and the need of organisations to be able to cater for those patients. And I think if we just make a mental note looking at these, app, video, but app is very clearly sitting at the top in terms of what people would like to provide and currently don't. And I think as we go forward into the next slide, you'll get an idea of some trends that are emerging here that are actually justifying prioritising of a few unmet needs. So, as I said, most common digital material development is the requirement. And I think if we combine this, as I said, with the data, this is further evidencing this needs to be a high priority area to help network organisations and for CLLAN to work to help provide resources and initiatives to help people deliver these. I know we're challenged because, as we touched on earlier, income, limited resources is a challenge for many organisations, but we've got to work creatively to try and find ways around this. But something that did pop up that's quite interesting in this chart there. 1/5 of all respondents would like to provide printed hard copy information. I found that quite surprising. I think that's something we need to look at further, whether we can, look at ways and initiatives to enable, delivery for these organisations, because not all CLL patients, not all people are digitally savvy. With switching over to digital operations and more digital, we are potentially actually keeping those people that are not digitally aware isolated. So we need to make sure as organisations that we do maintain traditional methods of information delivery, even if that's using old-fashioned methodology, the post. So I think, just in summary, one of the key areas, this summarises digital development as a key priority area. We can see from what I've just been saying that there is a gap in digital service provision across the network at the moment. And the surveys confirmed that there is effective use of digital support materials for patients by the majority of organisations. And the pandemic's accelerated, as we just said. And printed materials are still not provided by the significant number. Now, there's a clear ongoing need for continued development, because the pandemic's not going away. CLL patients are one of the most affected immune compromised groups. There's a considerable amount of uncertainty and safety, and it's very likely that to maintain contact and the appropriate support with organisations, this needs to be an ongoing development process. So we need to build this into not just a short-term strategy plan, but a long-term strategy plan. Now, as an action on this, CLLAN will continue to develop our website and our resources and abilities in the area of digital delivery. The survey has identified your key priority areas that you wish us to focus on. Some of that has actually informed Horizons. And most importantly, we need to work with you as a network to explore lessons and barriers that you as members are experiencing to help us develop together support strategies that are meaningful and relevant to your location. And I think one of the things I highlighted earlier was, amongst looking at innovation, the highest requested item that people don't currently provide are app-based services. And there are organizations within the network that are successfully using apps. And I think this is information we need to share and work with stakeholders to find out what is the most appropriate. In countries, we're working with the clinical communities as well to implement these into day-to-day healthcare. So this is something that we can't leave standing by now. If patients and their families, those affected by CLL, are isolated, they need immediate contact and they need to be able to get feedback. So this is something that we are suggesting is a priority area for exploration. So the next two charts, they're interesting, and I'll flick backwards and forwards between them. So the first chart here emphasizes what services you do not provide but would like to provide. And highlighted in pink there is a reason for these, because I want you to be able to see where they sit in the chart of what you already do provide. But if we look at services, and obviously this is a session in the area of access, a clinical trials directory is sitting at the very top. 42% would like access to more information about clinical trials for the organisation and for their patients. And again, interestingly, around access, which is the main gist of these sessions, 28% of respondents want access to information how to become involved in health technology appraisal, to encourage access to new drugs and the process. And the session before my talk has been covering that. So hopefully this has addressed many of the questions and answers you've got in that area. And they're highlighted for several reasons, because the next slides were like that. Fundraising resources are very high up in the list for many obvious reasons. But I think we have problems when we look at how that's delivered. So that's something the network is looking to work to help empower our network members and other organisations. And I've just flagged awareness campaigns because, and that'll come to light when we look at the next slides, but that's sitting somewhere in the middle of the table in terms of a request of what people would like to provide. And that will be eluded when we look at what people do provide. Awareness campaigns are very high on the very top, it's nearly the very top of services provided by the very majority of organisations. Obviously, patient support, education, telephone support, CLL news, traditional forms of information are sitting top. It's really encouraging to see now that 61%, 35 of you are actually reaching your patient groups digitally by webinar. But I'm flagging awareness campaigns because that will come clear in the next slide. But again, fundraising resources, we know how underfunded everybody is. We know the challenges that we have at the moment with COVID, with in-person activities being a little bit limited, in some areas non-existent. So therefore, if you rely on that for fundraising, heavy dependence on single funding, quite often from industry. And again, services provided by organisations, very few provide services related to health technology appraisal or are involved in the process. And this is something we need to change together. And sitting right at the bottom, clinical trials directory. Very little information is provided by organisations around the globe for patients in access and understanding what's available in clinical trials. What are organisations doing well? Well, question 8 in the survey was an open-ended question, and a thematic analysis actually coded everything to be able to grade what your organisation is doing well. And looking at responses, 2/3 of organisations responded to the question that they're doing well with support provision, which is great to hear. Whereas fewer feel they're doing well with information material provision and education. And hopefully that's something we can actually address when we're looking at digital delivery strategies and helping empower with how you can provide the information you need to. But I think what's really shocking, well, it is for me, strikingly, only 19% of organisations feel that they're doing well with advocacy. Now, we're all here together as an advocacy network, and we're going to have to work a lot harder in this area, because, for example, raising awareness sits in that that's part of campaigning and advocacy. And advocacy and campaigning are very key towards the addressing equity of access and actually pushing for access to new treatments and appropriate care. So the main reasons I touched on earlier across all regions for non-delivery of services was a lack of human and financial resources. This is something we all experience and something we also experience as CLL Advocates Network as we rely on working with network members to deliver our services. So I think we need to work as a top priority to look at exploring successful fundraising and campaign and advocacy in our priorities and initiatives that come out of our strategic planning. Moving on to clinical trials, I brought this one in because obviously access to a clinical trials directory and understanding of clinical trials has been flagged and highlighted in earlier questions and returns. And I think if we look at this question here, do you think your patients have got enough opportunity to take part in clinical trials? I think we can clearly see here, looking at the no's, and yes, to some extent, that there is not great opportunity, hence a reason we need to get more involved in advocacy initiatives, health technology appraisal or assessment, sorry, is the right term for that, to ensure that there is equity of access, and we are pushing for appropriate treatments and trials in countries where there are not. So nearly half of respondents, 47%, don't think CLL patients in their country have enough opportunities to take part in clinical trials. So winding up on clinical trials is one of our key observations. As I said earlier, 42% of CLL supporting organisations report that they want the clinical trials directives as a priority. And we touched on earlier, there's an issue around awareness and access. But we have a problem. I mean, creating a clinical trials directory is complex, it's challenging, it's not sustainable. We've talked about this through many years of how we can do this, but there is an opportunity for CLLAN to explore creation of a signposting resort that would be web-based and we could host on the website. And we've discussed this as a steering committee. We've had access to some of the early trends coming out of the survey, and we've been working in our preliminary discussions. We prepare our short-term and long-term strategies. But before we move forward with that, we need your engagement and your involvement. So we are already exploring producing a signposting service, and that would be hosted on the CLLAN website. And that we're looking at ways we can link. We don't want to reinvent the wheel, but we'll link to existing service and gather information from existing search databases, linking in to make sure that we can provide information. As one of the most powerful, which is clinicaltrials.gov, but there are many regional databases in different parts of the world. And I think, as I touched on earlier, we need to develop advocacy initiatives to raise clinical trial awareness and advocacy involvement. So let's just look at a broader brush. Next steps with the survey. The full survey report will be finalised in due course. The analysts, and it needs a lot of work at the moment to identify the key recommendations and then prepare for publishing and circulation to all of you as participants, and publishing within the clinical community and the broader community to help with awareness raising and understanding. CLL Advocates Network, we will formulate a strategic plan to address all of the key issues that are coming from the survey report. And these strategies and recommendations are going to be a core part, using these unmet needs to determine the network priorities. And as I touched on, we've already had an initial strategic planning meeting. And towards the end of this year, we have the second phase of that. And in the new year, we'll be finalising that with a long-term strategy. And part of this is we need to not just develop global, but we need regional and more local recommendations. And to do this, we need your engagement and we need to work with you. We need to bring focus groups together from the community to tackle specific unmet needs and recommendations and solutions that are relevant to you. What I would like to say, we're already well underway with part of this empowerment in terms of we are already building a global directory of CLL support services, and this is being hosted and will be hosted on the website, the framework, the infrastructure, and that's being populated. And that's being populated by your very detailed returns of how you provide support to patients in your countries. This could become, and we hope becomes, a go-to place which will actually help people. It's searchable by location, by many different ways, and will enable people that don't have resources to be able to find resources in the same language or in their proximity in their country over a border, that kind of thing. So we'll keep you updated on all of that. And I'd like to just wind up by emphasizing, to deliver all of this, we need to expand the network capabilities. And the survey is developing clear unmet needs. Great. Now we need to deal with them. And it's also identifying your strengths and weaknesses. So we're looking to develop opportunities to work with you as network members to extend these capabilities and aid capacity building in key areas in your countries that have been developed by the survey returns. And to do this, we need more involvement, and we need to involve you more as members in the network. So first, the survey has identified this, out of 57 participants, we can see clearly there that we have 31 members and we have 26 non-members. Most non-members have said in the survey that they would like to join the network. The survey identifies the benefits of the network and also the capabilities of organizations within the network. So please do get in touch, use the email below and follow up with Nicole and join us, because together then we become a stronger force, and we will, we can combine our knowledge. I think from a CLLAN, CLL Advocates leadership point of view, we now need to include your involvement as members from the top down. We need to extend the capabilities of the steering committee from a governance point of view. We need experts in different areas and disciplines, in professional areas, as well as expertise and understanding of delivery of advocacy and healthcare and patient support in your countries. Most importantly, though, to make any outputs from all of our work and in the strategy. We need project working groups with you as members partaking in these with us, and we're going to need to create local focus groups to shape and develop these future initiatives and regional priorities. So please, if you're interested in being a member, if you're interested in being involved, please contact Nicole on the email below, and please do enjoy the rest of the conference. I think we've still got some way to go, and I'd like to just thank you all for listening.